All right, for the skull bones, there are 8 cranial bones, which we'll talk about first. This is the frontal bone, the parietal bone, the occipital bone, the temporal bone, and then there are 2 bones that are located deeper inside the skull. They are the ethmoid bone and then the sphenoid bone. We will see those individually later. Those are the bones that will be surrounding the cranial cavity. Next, let's talk about the facial bones. We've got the nasal bone. This is the maxilla, it's going to be the upper jaw. This is the lacrimal bone, the one with a little hole right there. This is the lacrimal bone. Inside the nasal cavity, we have the inferior nasal concha. This lower part, so this midline structure here, this top part's part of the ethmoid bone. This lower part is its own separate bone that's connected to it. This is called the vomer. The lower jawbone is the mandible. The cheekbones are the zygomatic bones. On the bottom, we have the palatine bone. And then we also have part of the vomer right there. Lots of those bones are going to be paired bones. So when we count them all together, there's 14 facial bones. For the sutures that you will need to know, we have the coronal suture, the sagittal suture. This one on the side is going to be the squamous suture. And then back here is going to be the lambdoid suture. For the landmarks in the anterior view, we've got the glabella. This is the supraorbital foramen or supraorbital notch. The infraorbital foramen. This is the mental foramen as part of the mandible. Inside here we have the middle nasal concha is going to be part of the ethmoid bone there. And then this is called the perpendicular plate, also part of the ethmoid bone. On both the maxilla and the mandible, we have these bumps right here that form the teeth sockets. These are called alveolar processes. So each individual one is an alveolar process. For the lateral view, we have the zygomatic bone here, temporal bone here. This structure right here is called the zygomatic arch. Now the part of the zygomatic bone that contributes to the arch is called the temporal process. And then the part of the temporal bone that's contributing to the arch is the zygomatic process. So we have the zygomatic bone, temporal process of the zygomatic bone, temporal bone, zygomatic process of the temporal bone. Together, the 2 processes form the zygomatic arch. Okay, we also have the external acoustic meatus or external auditory canal, mastoid process, styloid process. This hole right here is called the nasolacrimal canal. And then here in the back, this bump on the back of the head is the external occipital protuberance. Now I'm going to take the mandible off. All right, let's go ahead and talk about the mandible, the lower jawbone. For this, we have the mandibular condyle or the condylar process, the cornoid process. So I remember this as condylar process, cornoid process, candy corn. Then we have the ramus, the angle, so the ramus of the mandible or mandibular ramus, angle of the mandible or mandibular angle, mental foramen, and then this one is the mandibular foramen back here. The sockets right here, those would be those alveolar processes, or individual ones would be alveolar process.